It is Wednesday, June 16th, 2021. This is our 216th episode, Facebook Live for the Kahnawà COVID-19 Task Force. It is a rather historic one because, as everyone knows, things are changing, things are getting better, and we have lots of news today. We'd like to start off with the Executive Director of the Cadre Memorial Hospital Centre and, of course, a member in good standing of the task force, Lisa Westaway. Lisa?
Good afternoon. So I do have a few updates today. Just to mention that we will have 217 on Tuesday. So today is not the last task force update, but we do have some important information to give as it was our last task force meeting. Some changes happening at the testing site. So as of Monday, we will only be open 3 days a week. So that's Mondays, Wednesdays, and Fridays. Information has been posted on the KMHC website on social media. Next week and the week after are special weeks because Friday the 25th and Friday, July 2nd are both holidays. What that means is that next week and the week after, the testing site will only be open on Monday and Wednesday. So important, what we've put in our release is access to the Shadagi testing site as well as the address. And so when we are closed, you can get tested at the Shadagi site. And in fact, we hope that you do if you do have symptoms. About testing, I wanted to just give a little bit of stats because we do continue to test at the testing site. We also continue to screen employees who are not vaccinated in order to mitigate risk in our EDC organizations. So just a few stats that we'll put up on the screen on Tuesday, but that I thought were important to mention still today. During the first wave, we did 635 COVID tests. During the second wave, which started in September, we did 1,639 COVID tests. And in the third wave, which started March 29th, we did 864 COVID tests. So a total of 3,157 COVID tests were done at the Kahnawà testing site. This was instrumental really in protecting the community, so we thank all of you for coming in when you do notice symptoms. Of those 3,157 tests, we had 22 positive in the first wave, 86 in the second wave, and 26 in the third wave. However, through all of that, we had 2 hospitalizations and 0 death and 0 ICU stays as a result of COVID. So this is all positive news. In fact, we did succeed in protecting our most vulnerable. So the testing site is being used less and less. Actually, between May and June, we've decreased significantly. So in May, 337 tests were performed. In June, only 69. And that's why we are slowly scaling back on the availability of the testing site, because as many of you know, our resources, thank you to all who are very flexible, but those resources actually normally work in different areas of the hospital. So we would like to try to get back to some of our existing services and therefore are closing the testing site 2 days a week. Over the course of the summer, we'll be evaluating whether the Kahnawà testing site should remain open or not. For the time being, as I said, we have our 3 days a week. However, that might change in the coming months. I wanted to talk a little bit about vaccination, which continues as we speak at the bingo hall. Vaccination is going really, really well. We're well underway for the second doses. So I'll give you a few stats about that as well. So first doses continue to increase. As you know, we will never turn anyone away who has changed their mind or who wants to have their first dose. So 18 plus is creeping up our percentage. We're now at 76.7 for first doses. 16 to 17-year-olds, you guys are the winners. You're at 82%. Really, really great response from our 16, 17-year-olds. Thank you. That really shows shows your desire to protect your loved ones. So keep that up and make sure you come for your second vaccine. 12 to 15-year-olds are at 56%, and that has creeped up as well. So we really urge you to keep up with the science, to read reputable sources. If you do have some hesitation as parents with respect to getting your children vaccinated, please call a nurse at KMHC at extension 2213, voice your opinion, ask your questions, and we hope to give you the most informative information, medically based, so that you can make an informed decision for your children. Again, vaccinations will have an impact on how we return to school in September. Those numbers that we have may be higher. We unfortunately don't have statistics for our 12 to 15-year-olds who are vaccinated in outside schools. So it is possible that that 56% is higher, but we hope to be able to have access to that information shortly. Second doses. So for 18 plus, we're now at 36.7%. Thank you for honoring your appointments as much as possible and coming in for your second doses. It's really, really important, especially in the face of the variants. We really see that 2 doses are required in order to protect our community from COVID-related variants of concern. And without those second doses, we leave ourselves very vulnerable. So it's important to come in for your second dose. 16 and 17-year-olds are already at 32.6%. And of course, 12 to 15-year-olds, we've just started vaccinating, so they're not ready for their second dose yet. Vaccinations continue. One question that we're getting a lot at the vaccination site, or that our nurses are getting, is with respect to quarantining when after traveling. So we just want to point out an important fact, and again, it's just information so that you have it and you are able to make informed decisions, that even if parents are vaccinated when traveling or crossing the border, when you come back, if your children are not vaccinated, there still will be, at this point in time, there still will be quarantining expectations. So I think it's important that you are aware of that when you're making your decisions, especially if you are a family that frequently travels. Lastly, I wanted to talk about public health. So as you know, today was the last task force meeting, and Lloyd will be presenting information that came out of that meeting, directives that were approved, and information about moving into the yellow phase and moving into our third reopening phase this Friday. And with those changes, we move into a state of recovery. And in that state of recovery, there will be still a lot of information that is required to share with you regarding public health measures. So in the same way that in March, measures changed on a daily, weekly basis, we are finding that we're being faced with those frequent changes regarding public health measures right now as we move towards reopening and as we continue to monitor about possible fourth waves in the future, although we keep our fingers crossed that that won't be the case. And so we find ourselves in a situation where we need to, although our COVID updates on Facebook Live may end, although our radio appearances may end, we still need to find a way to communicate with all of you regarding the most up-to-date public health measures so that you are informed and you're able to make those important decisions for yourselves and your families to ensure safety. So what we have here is you don't need to read this, but it's just a communique, just to give you an idea that this is the type of thing that we'll be releasing on a very regular basis, sometimes every couple of days, sometimes every week, sometimes once a month, depending on how quickly the public health directives change here in Kahnawà across the province as well. So our public health team, Kahnawà Public Health at KMHC, will remain in place. Our testing will remain in place, our contact tracing, all of those things remain in place because COVID still exists. Despite our high vaccination rates, we do expect to have more COVID-19 cases. We hope to not have, but we're prepared if we do to react quickly and protect the community should that be the case. And so keeping you up to date with those measures is really important. So I'm going to just give a few updated measures today. A release will come out next Tuesday explaining these measures. However, there's not a huge difference from what you already know, but points are important to reiterate today. So the first thing that we really want to focus on, despite the end of the state of emergency, is that if you have COVID-related symptoms, please get tested. This is especially important in order to mitigate risk within the community and quickly control any type of transmission of the virus within the community. So we need to still do this. Remember, we had always said that if we can identify positive cases, contact trace within 24 hours, and isolate people who need to be isolated, then we protect the community and those that are most vulnerable. So that is imperative as we move forward into the recovery phase, that we're able to continue to do that role. So when you have COVID-related symptoms and the symptoms are still the same, one of the A symptoms or two of the B symptoms, and you could find them on our KMHC website, then please get tested. Another area that is interesting and we spoke about last week is that if you are fully vaccinated, and that means 7 days after your second dose, if you're fully vaccinated, then even if you're a contact of a positive case, you no longer have to self-isolate. So even if someone in your household has COVID and you are fully vaccinated, then you don't have to self-isolate if you don't have symptoms. You continue to go about your daily life, but you self-monitor. You check yourself for symptoms on a day-to-day basis, and only if you develop symptoms do you go in for testing. There could be some exceptions to this rule depending on if we were to have a huge outbreak in the community. However, generally, this is a really positive development as a result of vaccination. Masking. So while many of you are saying, you know, if we have such high vaccination rates, when are these measures going to change? So masking is something that is changing for the general public. If you are fully vaccinated and you are able to maintain the 2-meter distancing required between households, then you no longer have to wear masks in outdoor public areas. This is an important change. In private areas, so when I say private, I mean your own home. Your own home, inside your home, in your backyard, with your friends. It really is, we really are putting the responsibility on you to define for you and for your family what you're most comfortable with, for you to ask questions of those who are coming into your home. And if you're comfortable and all of your guests are vaccinated with 2 doses, because remember, 1 dose is not enough, with 2 doses, then you can make the decision as a group to not wear masks. This is a personal and private decision, and we ask that we be respectful of each other's choices, knowing that some of us have chosen to not be vaccinated, some of us are, some of us even when we're vaccinated might choose to wear masks. This is all okay. We have to be really open to everybody's choices because we don't know what each other's personal lives are. So anybody who's living with someone who's immunocompromised, anybody who's living with someone who is over 70, who may or may not be vaccinated, we all have different vulnerabilities within our families and different risk levels, and therefore we have to feel comfortable to make our own choices and decisions, especially within our own homes. So we ask all community members to be respectful of each other during this transition time. With respect to distancing, so right now at the present time there are no changes to the distancing rules. So when you are two different households, whether vaccinated or not, we ask that you maintain the 2-meter distance in public settings or within our work organizations, for example. Of course, in a private setting, again, such as your home, these are your personal choices. However, safety, if you're not vaccinated, you're mitigating risk as much as you can when you're not vaccinated by maintaining the 2-meter distance and wearing your masks. So it's important that you have this information. One element that we continue to do to mitigate risk is have registries in all of our businesses, our restaurants, our organizations, and we would request that you do the same in your home so that you always know who is in your personal space at any particular time. So if we do need to contact trace, we're able to do so. The more contacts that we have, the more difficult it is to go back in time and remember who we saw when, who was within 2 meters when, who was wearing a mask and who wasn't. So having that information regularly within your home or in any of our public spaces is really helpful in ensuring that we mitigate risk of transmission and having huge outbreaks in the future. So we ask that you continue to do that. So I'm not going to talk about the end of the task force anymore today because we're going to save that for Tuesday. But just a last note that as we move into this new phase, a thank you really to all of you for working together with us and really making all of our endeavors a huge success in the community. So, and we'll talk more about that on Tuesday. Thanks.
And thank you very much, Lisa. And as she mentioned, there's an important date coming up on Friday, and here to tell us about that and some of the directives that came from today's final task force meeting is the Commissioner of Public Safety, Lloyd Phillips. Lloyd?
Thank you, Joe. Thank you very much, Lisa, for that information and update for the community. Yeah, so very interesting day today, to say the least. You know, when I did refer to it earlier with the task force, it's kind of historic given the events over the past many months since March of 2020 to be finally ending the state of emergency and then having a last task force meeting. There is still some work to be done after the state of emergency expires. There still is the recovery phase of the pandemic, which I will remain part of, as well with the Public Safety Commission, as well as Public Health will remain vital in seeing that through. No, but it does mark a milestone. The task force mandate as it exists today and has existed since March of 2020 will expire midnight on the 21st of June. So with that said, we did have our final task force meeting today, and there were several directives that were passed that will carry over into the recovery phase. And according to the Kahnawà Emergency Preparedness Law, directives that are in effect and identified do remain in effect in the recovery phase until such time it is deemed that we have achieved a state of normalcy, and then another directive will be issued that will formally end any type of measures under the Kahnawà Emergency Preparedness Law. So we are definitely moving in that direction. So a number of directives that were done today was, again, the first one, the numbers may not follow the order exactly, but 62.1 is a directive that moves us officially, the Kahnawà move into phase 3 of the reopening plan and move us into the yellow level alert. So we are effective on June 18th, which is Friday. Kahnawà will officially begin phase 3 of reopening, and we have downgraded our alert level to yellow. Again, all things pointing in the right direction, and we also want to thank the community to allow us to get through this area and this level of alert, which is important to keep moving forward. But at the same time, and we have to keep underscoring this, we cannot fully let down our guard. We must keep our eyes on what's happening in the community and around the world, for that matter, because this is a worldwide pandemic, but we are in a very good place as we speak today. We also passed a directive today, Directive 65, entitled the Recovery Phase, Recovery Monitoring and Authority, which is a directive that formally empowers the Kahnawake Public Safety Commission and Kahnawake Public Health to carry on the measures required, the directives required to ensure the public health and public safety of the community is maintained. Make modifications, adaptations to those directives with the goal of achieving normalcy. So the goal is to continue to reduce those measures over the weeks and until we're able to feel confident that we could totally remove any directives requiring public health or public safety to address. So that is a formality, not so much a formality, but it's a formal process, I should say, based upon the Kahnawake Emergency Preparedness Law under the recovery phase within that law and in accordance with Kahnawake regulations in that sense. Directive 64, a very important directive, which in a nutshell basically takes many directives that are currently on the books since March of 2020 and officially rescinds them. And in some cases are replaced. I'll talk about that in a minute. But we do have a number of directives that will either automatically expire come June 21st or have been officially rescinded. What we want to do is basically move into the recovery phase with a clean slate, to be clear on what measures are currently in effect, and also much clearer to communicate to the community, when we only have 10 directives or so posted up on the website to refer to. So Directive 64 was passed as well, and maybe just to give a quick look, it's quite a number of directives on there that would that has been all rescinded, 60 or so some odd directives. Again, just for you just to be aware that there's a number there. It's not important for you to know numbers, but I just wanted to emphasize the fact that we do have these being rescinded. We didn't realize once you start going through the entire package and all the directives that were passed over the past since March of 2020, there was we found there was many that were there that need to be modified and updated. We do have a few other directives that are important to mention to the community. One based on the recovery phase for businesses. This will be formally released tomorrow, but basically it is rescinding all previous directives relating to businesses, and the phased-in approach, which I'll touch on in a minute, becomes the directive in itself. So any information you require from various industries, you refer to the phased-in chart, and that gives you the latest measures in place. So any directives that are not outlined on that form have been rescinded. Very similarly for public and private gatherings, any previous directives on that have also been rescinded. And again, referring back to the phase 3 and phase 4 reopening plan is what's going to apply, because that in and of itself is a directive. So if you're wondering how many people am I allowed in my home, how many people in my backyard and such, you refer back to that chart, which will be released very, very soon. That will give you the idea of what you are permitted, and that all comes into effect on Friday. Indoor and outdoor sports follow the same guidelines. No sports have been gradually being opened throughout the past several weeks into several months actually, but now we're at a point where we continue moving forward. Modifications were made to directives earlier, such as the masks are no longer required while playing and stuff. So things are being tweaked and monitored as we move forward. But again, if you're a sports, indoor or outdoor, again, you refer to that phased-in chart, and it will give you the information that you require. Also, we have Directive 69, which is the Kahnawà Emergency Food Services, which has been run through KSCS since March of 2020. They are in the process of winding down their services and evaluating the needs for the community. But after the state of emergency, their mandate formally ends, and they are in the process of evaluating the needs and transferring the authority back to the overall stand-up food basket and/or other authorities that may be required to ensure that those in need do receive the support, not only during the recovery phase, but going forward in the community, because we do know the food basket service did exist prior to the pandemic. Directive 68 as well, also all in effect, which is the Kahnawà Economic Relief Measures, commonly referred to now as the KERM fund, which is already in the process of winding down, as well as the businesses are reopening. More and more people are leaving the KERM and seeking employment. In phase 3, I'm sure more people will be eligible and be able to return to employment. So that will be a phased out process, because the KERM was initially developed as a mandate from the task force going back again to March of 2020 to have support for community members who are out of work. That developed where it was. They have been running independently of the task force with their own board of directors, but this directive formally transfers 100% of that responsibility to the KERM, and that it's no longer required as a task force directive, and they will take the appropriate steps to maintain, modify, change, or stop certain services that are required, and that will be done by the KERM board of directors, as well as the executive directors committee organizations, mostly all the community organizations. They have reopening plans that are being developed. The Public Safety Commission and Public Health will act as a consultation service to them, but it is their responsibility moving forward to determine how to reintegrate staff back into the workplace. Like many places have been working with a skeleton crew. A lot of people have been working from home. Some successfully, some it's been a challenge. But as of July 2nd, that they can start their reintegration plan. So from a task force perspective, it was passed that that is now on the directors and organizations to make the determinations based upon public health recommendations. They must still follow public health measures. However, the final decisions on who and what and where things happen within their organizations, or those entities affiliated with their organizations, will now be with the entity, that organization, whether it be KSCS, MCK, KMHC, will be up to them to make that determination that it will no longer rest with task force or moving forward public health or the Public Safety Commission. So a lot of things passed today to kind of take us into the recovery phase, and these directives into itself carries us forward, ensuring that we have a strong public health team that is under the emergency preparedness law. We have a Public Safety Commission that's going to carry and guide the directives and make amendments as deemed required. And we'll talk more about that next week. But many of the members of the task force are also members of the Safety Commission to have consistency in moving forward. So we'll feel very confident on that. But it still does mark a major changing point, and not requiring a full task force to continue to be in operation. I'm not sure. We're going to bring this up on the screen. I refer to this a lot in my discussion about phase 3 reopening. This is the document is a directive into itself, and this will come into effect, as you see on there, June 18, which is Friday, officially moving into yellow, as well as officially phase 3. Some of the measures that are continuing to be loosened, including the reopening of bars and social clubs in the community with limited capacity of 70%. Public health measures must be in effect. No golf courses, for example, golf carts can be used and shared between 2 people from different households, provided that they are fully vaccinated. If not, they will require to wear masks. Self-serve gas stations will be allowed with safety measures. Indoor and outdoor contact sports and recreations will allow spectators now to be there. I know people have been abiding by that very well since the beginning, and I even asked yesterday, matter of fact, at the ball field when they're allowed to have spectators. So the answer is effective Friday if you want to open the stands and have spectators there, respecting all the measures in place, but it is a step in the right direction. No churches and funerals and ceremonial gatherings, the capacity could reach to 75%. Restaurants could have 75%, and their bars, if you have a restaurant/bar, they could open. Again, distance requirements in place. Gaming establishments within the community can open according to the pre-approved yellow zone restrictions, as well as the bars could open with distancing. Cigar lounges, again, 75% capacity. And there's a little more detail there, but that's the key points. I just want to point out as well, for the gaming establishments, they are very unique in terms of they're a large gathering place. They'll have a restaurant, they got bar, they got food. So we have pre-approved directives that go along with them, and we're in direct contact with them on when and how they open up. So just for the community to be aware of that, because there is not much detail in the document. But we do have understandings and agreements between the task force and the gaming establishments within the community. So I know this was a long show. It was hopefully an informative show. We were expecting a lot of new information coming out today, as it was again the last formal task force meeting and the last task force meeting during the state of emergency. And this is going to be the last task force meeting update during state of emergency. As Lisa mentioned, and we are going to have a final task force update on Tuesday, the 22nd, which marks the official end of the mandate of a task force, officially ends the state of emergency, and is the first day of officially being in the recovery phase of the pandemic. So we'll have much more to say on Tuesday. Please join in, and thank you very much, and onigawahi.
Thank you so much, Lloyd. There's a lot to digest there. And again, with all of that information, the press release is going out. It may be out as we speak, as a matter of fact, on the reopening. And for all of the details, you can actually click onto the site and it'll have those details, because otherwise we'd be here all night going over the specifics. And yes, today is a very, very important day. David Lahash will be here on Tuesday for the next program. I just want to say on my behalf that it's been an honor to assist in bringing this information to the community and those outside the community who are from Kahnawà and may be watching from other places. It has really been an adventure, and I'm proud of the work that has been done here. Also, I'd like to take the opportunity to thank the crew here, who have been behind the scenes throughout, the people in the EOC, and especially the crew that I work with each and every day. Wenadeo Daibo, Skylar Taylor, Jean Daibo, Justice Polson Lahash, David Lahash, who rejoined us, really glad to see him, Dega Lazar, Stephen Daibo, Neil McCumber, our former director, and also Raymond Montour from the Cadre Memorial Hospital Center, all did a lot of work behind the scenes. So we have some good news. We take that orange sign off, it becomes yellow when we're here on Tuesday, and we hope that you have a great weekend and a safe weekend, and we shall see you next time. So on behalf of everybody here, Nyawakoa, Tano, Onigiwahi.